from the News Channel 5 network. This is Inside Politics.
Hello, everyone. I'm News Channel 5's political analyst, Pat Nolan. Welcome to Inside Politics. For nearly the past 2.5 years, he's been one of the leading figures in Nashville's fight against the COVID-19 pandemic. Now, Dr. Alex Jahangir has published a diary of his reflections on the first year plus of that very challenging period for everyone. It's also been an experience that has divided us in so many ways. The book is entitled Hotspot, A Doctor's Diary from the Pandemic. Dr. Jahangir has appeared with us several times on this program during even some of the worst days of the pandemic. Doctor, thank you for joining us on Inside Politics. It's good to see you again.
Thank you. It's great to be here.
Have you always kept a diary, or is this something you did just because of this, because perhaps you thought this was going to be a unique and historic situation?
Yeah, no, I never kept a diary. And, when my mother-in-law's father, who was a World War II pilot, died, she pulled out all these letters that he had written her mom back in the day. And it was so neat reading through those. And so when the pandemic started, I probably, like everyone else, thought this would last a few months. And I thought how neat it would be if my young kids could somehow have a record of what the couple of months we were going to experience that they weren't going to remember would be like. So in my home office, I had a little composition book that I usually put stickers for patients I operate on, just so I have a record of that. And I just started every day jotting down just very basic information: how many cases, how many deaths, and what we did that day. And so no, this is the first time I ever had kept a journal like that.
So originally this was for your children, maybe your grandchildren down the road. When did it begin to dawn on you that maybe this was historic enough that you wanted to publish it as a book?
You know, I had not told anyone except my wife. I was keeping this. And about a year and a half into the experience, one day I was just sitting at my desk and started reading. And I was like, gosh, this is pretty wild what we did. And so I just happened in passing to mention it to some of my colleagues who work more in the PR and media world, and all of them perked up, their ears perked up, and they're like, what do you mean you kept some notes? And nobody knew. And we started talking about it, and one thing led to another. It was initially just going to be a little bit of an article, and then one thing led to another, and here we are.
When did it first dawn on you that this wasn't going to be a couple of weeks or a couple of months, and now we're 2.5 years and we're still in the middle of it?
You know, I wish I had a good answer for that. I think it just kept going and going and going, and I don't know. I think, like most people, I always thought we were almost at the end.
Are you still keeping the diary?
I'm not. I'm no longer keeping a diary.
So you don't have a part two for this, even though the pandemic's still here, people are still dying every day, people are being hospitalized. I mean, you don't think this diary is premature, do you, to publish it?
So what I wanted to really capture in this was really the first year of the pandemic, right? I think, as you point out, we could talk about the pandemic for decades. But really, this is not meant to be some retrospective analysis of the whole response. But that first year, think about all Nashville went through. We went through a tornado, which was one of the worst in the history of America. Then we went into, obviously, the pandemic, the bombing, the Del Rechos, the social unrest, the flood. I mean, there's so much that happened that 1 year. And so I really wanted to focus on that first year experience from my perspective. And then talk a little bit at the very end. I did an epilogue, really kind of talks about some of that summer of 21 as well.
During the book, you seem to indicate that so many things were happening that after a while you got a little bit almost paranoid about it. You thought everything that was happening, you were trying to see, does this have something, particularly the bombing downtown, does this have something to do with pushback against the virus? Well,
I think, especially if you think about not the first 3 and 4 months, but really months 9, 10, 11, even where we are now, there's such divisiveness in our society now, and lack of rational thinking, frankly, sometimes when it comes around the virus. So I did worry. I mean, frankly, when the bombing initially happened, is this secondary to some crazy obsession with some policies? I had some personal interactions in the street that some of which I fundamentally believed it was not rational how these individuals reacted. So there was a little paranoia, I think, but at the end of the day, I try to ground those.
You use a surgical term in your book several times. You saw the phrase is "all bleeding stops."
Yeah.
Is COVID-19 ever going to come to an end? Is the bleeding for that ever going to stop? And when might that be?
So that statement really implies, as you're hinting, that all bleeding does stop. Now, it either stops because, as a surgeon, we intervene and stop the bleeding, or the patient bleeds out. I believe the bleeding around COVID has come. We've got that under control, right? So we know how the vaccines. We have treatment modalities. The bleeding I'm really worried about, Pat, and I mentioned in the book a little bit, is the bleeding around the civility of our society, in our community now. I think that's the bleeding that I don't know if that's going to stop because we're going to get it under control, or if it's going to continue to down spiral, and that's the bleeding I worry most about right now.
Back during the really dark days of the pandemic, were there days when you were so tired and so distressed that you didn't even want to write any notes down? That it was
of course.
Just because you just too tired to even think about it? Want to just go to sleep?
I think there were many days we all had that were just exhausting. And yes, of course I had those days. I still kept the discipline of writing what I experienced. Again, the journal, if I were to show them to you, there's not much emotion in there. It's really just factual of what happened. It was only in hindsight that I brought out some of the emotions of what happened. But, like every other Nashvilleian and Tennessean and American, we drudged through it, and I was no different than anyone else who experienced that.
You don't detail every day. People are not going to read this book and find out you've got every day from now past year and a half before the big part of the pandemic. Did in some cases, because yes, things happen very frequently, but sometimes they didn't. Would it just be overwhelming to put the same thing over and over again as it slowly got worse and worse?
Well, so in the journal, I do have every day written. So just so you know, 7 days a week.
You picked out the key days.
But what I did is I picked out key themes, right? So I picked out days that we had something severe happen, or days, our first death, or safer at home day, days that I recognized that our treatment of our new American community could have been better. I brought out key themes, days we had the protests in the downtown. I tried to bring out key themes of that year, but yeah, I didn't write 365 days of notes.
Coming forward to today, does the Metro Coronavirus Task Force still exist? Has it been dissolved, or is it sort of on pause, waiting to see, God forbid, worse things come up, say this winter or some other time?
Well, I think the whole reason the task force was initially placed was to bring a full response from all aspects of government. We are now 2.5 years in. The task force per se is no longer in existence. My term on the Board of Health has ended, but we have a strong public health infrastructure that is always on the lookout.
Dr. Alex Jahangir is our guest. He was the face and the voice, somebody you saw all the time on television talking about Nashville's fight against the COVID-19 pandemic. He's written a book called Hotspot, A Doctor's Diary from the Pandemic. Back to continue our conversation after this break.